Today we're going to dig deeper into an issue of a keen interest, particularly to those people who deal with state health policy and Medicaid in particular, long-term care. As we well know, long-term care as a share of the Medicaid budget is about 30%, so it accounts for about $125 billion a year out of the $415 billion in Medicaid spending, so it's a very substantial share of what is spent on Medicaid, and it's an area that's growing very quickly. So one of the key factors, I think, in terms of really maximizing value and being as efficient as we possibly can, is doing as best a job we can in predicting the risk factors for people needing long-term care services. And obviously, long-term care encompasses a whole variety of different types of settings, home and community-based settings, home health care settings, nursing home, and other institutional care. So really understanding the risk factors for long-term care placement can identify those at greatest risk, and I think do as good a job as possible in really linking people appropriately to the types of resources they need. Today we're going to hear about some novel and new approaches to doing this. We're going to hear about an innovative predictive care model that assesses risk factors for long-term care placement developed by researchers at Duke University in collaboration with the Connecticut Community Care. We'll also hear more about how long-term care is being addressed by state Medicaid programs.
We want to make sure that our members reside in their home and community as long as they are able to and wish to. So if you think about kind of what the data are telling us, they're indicating that MLTSS is a major cost driver for us. And so we want to make sure that we're providing that care as efficiently and effectively as possible. And so that gets into how we as a health plan use data in our normal everyday operations. One of the tools that we use most frequently is a predictive model. So we might use predictive models in any of several ways. So let's kind of go through some of the examples. We might use a predictive model to identify an individual who is at risk of an inpatient stay, so an extended stay in a hospital setting, or who might be at risk of going into an emergency room. We also focus on subpopulations such as pregnant women, so we can do data analyses that indicate to us that a woman might be at risk of a complicated or complex pregnancy. And in any one of those cases, the health plan's value proposition is essentially that we deploy a service coordinator to that individual to make sure that they have the access that they need to needed healthcare services that improve their health outcomes, but that also avoid a more costly medical incident.
Connecticut Community Care is a private nonprofit organization, and we were incorporated in 1980. We got our start a little bit earlier than that in the 1970s as a federal demonstration project. Interestingly enough, to determine whether or not providing home and community-based services could actually lower the likelihood of premature nursing home placement, and indeed it did. It was so successful that our state government also wanted to supplement some of the funding and provide a state-funded component to our program, which is now known as the Connecticut Home Care Program. We have a program for older adults and also for younger adults with disabilities. Our mission and our goal is to identify choices and to provide services for people of all ages and abilities and incomes so that they can live at home. And we've been doing that for 30 plus years. And we serve approximately 12,000 people per year. Our public program operates in 123 towns in Connecticut. We are considered an access agency for the Connecticut Home Care Program, which includes both a Medicaid waiver component and state-funded home and community-based services.
This prediction model enables care providers to implement targeted intervention for the high-risk populations, and if that approach can be effective or not, that need to be evaluated as a future study. And the second point is we developed this prediction model with having an outcome as a nursing home placement. But there might be more important outcomes such as quality of care. And quality of care can be looked at from the medical point of view looking at the mortality, nursing home place, hospitalization, frequency of hospitalization or emergency room visit, but also from patient-centered outcome point of view, patient and family satisfaction or caregiver burden will be a great important outcome to measure. And when you provide a service, it has to be cost-effective, but also if you're providing public-funded service, you have to think about fair distribution of service as well. For example, if the patient lives alone, needs some almost nursing home level care, we don't have any problem providing the care. But what if the patient has a family, live somewhere far away? Would you provide the same care as you provide for the person who lives alone? Or you might ask the patient's family member to provide more care. But if so, how would you encourage or support those family members to do the job that otherwise you might be just directly provide?
One of the ironies about this issue is that Medicaid and long-term care are two incredibly important issues that few people really know much about. And it's too bad because they are so big, they are so important, they are so instrumental to how the healthcare system and indeed society works. Medicaid surprises a lot of people when they find out just how big it is and just what its scope is. Last year, 72 million Americans found their way into the Medicaid program for some point of the year. And we spent more than $420 billion, combined state and federal. And Medicaid does a lot of things. Medicaid pays for 40% of the births in this country. Medicaid covers about a quarter of all the kids in this country. And Medicaid provides the majority of a lot of things that most people don't focus much on, including mental health treatments, HIV/AIDS treatments, and long-term care. People don't really think about those things. People don't really think about long-term care. If people do think about long-term care, they think, oh, well, either I won't need it, that's something that happens to somebody else, or, you know what, Medicare is going to take care of me, so I don't need to worry about it. And really none of those things is true, unfortunately. Medicaid has a huge, huge role in long-term care.